Welcome, and thank you for taking the time to view Group 107's video presentation on fifth disease. My name is Michael, and I'll be your presenter today. I'd like to begin by acknowledging the traditional owners of the land on which we meet today. I would also like to pay my respects to elders past and present. Fifth disease is a mild rash illness caused by Parvovirus B19. This disease is also called erythema infectiosum. It is most common in children than adults. Parvovirus B19, which causes fifth disease, spreads through respiratory secretions when an infected person coughs or sneezes. People with fifth disease who have weakened immune systems may be contagious for a longer amount of time. Parvovirus B19 can spread through blood or blood products. A pregnant woman who is infected with Parvovirus B19 can pass the virus to her baby. The first symptoms of fifth disease are usually mild and may include fever, runny nose, and headache. After several days, you may get a rash on your face called a slap cheek rash. This rash is the most recognized feature of fifth disease. It is the most common in children than adults. Some people may get a second rash a few days later on their chest, back, buttocks, or arms and legs. The rash may be itchy, especially on the soles of the feet. Healthcare providers can often diagnose fifth disease just by seeing a slap cheek rash on a patient's face. A blood test can be done to determine if you are susceptible or immune to Parvovirus B19 infection, or if you are recently infected. The blood test may be particularly helpful for pregnant women who may have been exposed to Parvovirus B19 and are suspected to have fifth disease. There is no vaccine or medicine that can prevent Parvovirus B19 infection. You can reduce your chance of being infected by following strict infection control practices. Fifth disease is usually mild and will go away on its own. Children and adults who are otherwise healthy usually recover completely. Treatment usually involves relieving symptoms such as fever, itching, and joint pain, and swelling. Topical ointments can be used to treat itching. Medications such as paracetamol and ibuprofen can also be used to treat cold and flu-like symptoms such as runny nose, fever, and headache. But however, these medications can be costly. The least expensive option is to rest and drink plenty of fluids. Out of all the research that my group has done, we do recommend the least expensive treatment as the best option. Thank you for viewing our presentation today. Before I go, I would like to add one more point. Healthcare providers who are pregnant should know about potential risks to their baby and discuss this with their doctor. All healthcare providers and patients should follow strict infection control practices to prevent Parvovirus B19 from spreading. And thank you.